Hi, Dr. Rodriguez. It's Paxton Marco. The date is November 30th, and I am going to point out some of the bones of the axial and the appendicular skeleton to you. So just really quickly, I just want to show you. I have the list here just in case I completely blank, but I don't think I'll need it. I've practiced a lot, but just so you know, I do have that list. There's no notes or anything on it, though. Okay, so let's see. I think I'm ready to begin. So, starting with the anterior view, we have the maxilla, which is the upper jaw. We have the mandible, which is the lower jaw. Nasal bone, frontal bone, or your forehead. Zygomatic, or your cheekbones. Sphenoid bone, which is seen like in the middle of the orbit. And then your lacrimal and your ethmoid bones. So, your lacrimal bone is a really small bone that's in the corner of the eye, and then right next to it, so a little bit more towards the middle of the orbit, is your ethmoid bone. And the ethmoid bone also forms a bit of the nasal septum. So this is actually the perpendicular, this line in the nose, perpendicular plate of the ethmoid. And at the bottom of it is a triangular shaped bone that's called the vomer. All right, moving on to the posterior skull, we have our occipital bone in the back. I'm not sure if you can see the suture line right there, but occipital bone, we have our parietal bone, and then on the sides we have our temporal bones, which are kind of beneath, like more of our temple areas, parietal bone up here, temporal, occipital, and then we can still see a little bit of the mandible right there. All right, so lateral view of the skull. Again, we have our nasal bone, we have our maxilla, we have our mandible, we have our zygomatic, we have our occipital, we can see a little bit in the back, we can see our frontal, parietal up here, temporal here, and then again we have the ethmoid and the lacrimal. So again, lacrimal is just that small bone that's right on the edge of the eye, corner of the eye, and then a little bit more towards the center of the orbit is your ethmoid bone. And just because I cannot remember, embarrassingly, if I said it, I think I said the zygomatic bone, which is your cheekbone, but just in case not, there it is again. Okay, so inferior skull, just looking at my list to make sure I didn't miss anything. So with this inferior skull view, we have, I'll start back here, we have the occipital bone back here. In front of that we have our temporal bone on either side. The parietal bone runs, it's pretty thin, it's like a thin kind of layer that you can see, but on the outside of the occipital and the temporal. Right here, along you can see this kind of ridge and wing shape almost, is the sphenoid bone, excuse me. Up in here is going to be your frontal bone, all in here. And then right there, that little ridge is your ethmoid bone. And I think yep, that's everything for that. Cool. So moving on to your vertebral column, you have C1, also called the atlas. You have C2, which is called the axis. And then those are, so your cervical vertebrae, you have 7 of them. So those are obviously number 1 and 2. So 1, 2, 3, 4, 5, 6, 7. The next 12 are your thoracic vertebrae. And then the last 5 are your lumbar vertebrae. Below the lumbar vertebra is your sacrum, which is 5 bones that have fused together. And then you have your coccyx, which is 3 to 5 bones that have fused together, and whether it's 3, 4, 5 bones that fuse, it just depends on the person. Okay, so thoracic cage. Thoracic cage, we have our sternum. We have the body of our sternum in this top bit, which is the manubrium. We have our ribs. Sorry, just thinking of that next part. So we have our ribs, and we have the first 7 are called true ribs. That's because they attach via costal cartilage to the sternum. And then we have false ribs, which are numbers 8 through 12, and that's because they don't directly attach to the sternum via cartilage like themselves. They actually, some of these ribs are going to attach to the cartilage of the rib above them, which attaches to the sternum. And finally, the last 2 False ribs are called floating ribs. Those are number 11 and 12, which you can see right here. 1, 2. And they're called floating ribs because they don't attach at all. Okay, let's see. So now we have the appendicular skeleton. So starting with the pectoral girdle, we have the clavicle, which we have 2, and we have the scapula, these 2 bones right here. Humerus is our upper arm bone, and then we have our radius and our ulna. This is the radius right here. You can see it has a bigger surface area on that bottom to connect to carpals, and then our ulna, which is right there. Awesome. Okay, hand and the wrist. So we have 8 carpal bones. This is your thumb, so I'm going to start from this side and go outward. So starting with this bottom layer, you have your scaphoid, your lunate, your triquetrum, and your pisiform, which is a sesamoid bone. And then this next layer, closer to your metacarpals, you have your trapezium, your trapezoid, your capitate, and your hamate over there. Then we have our metacarpals. As I mentioned, they're numbered from 1 to 5. Number 1 is the thumb, and then obviously numbers go that way. And then your phalanges. So each finger has 3 phalanges to it. They have a proximal, middle, and distal, except for your thumb, which only has a proximal and a distal. Okay, just get to the last page. Yep. All right, with the pelvic girdle, we have our ilium. We have the ischium. Sorry, let me move this view right here. Ischium. And then we have our pubic bone, and the pubic bones fuse together at something called the pubic symphysis, which is that area right there in the middle. Okay, then we have our patella, which is our kneecap, and then we have our tibia, which is this larger bone, and our fibula, which is a skinnier bone, and our femur right there. Did I forget anything? Nope, that's it. Awesome. Last area is just your ankle and your foot. Sorry, skeleton's really all over the place. So this is your calcaneus. It's kind of a weird view of it, but it's right back here. That's your heel bone. Then you have your talus, which is right there. In front of the talus is the navicular, and off to the side of it, more to the lateral side of your foot, is the cuboid bone. And then near your metatarsals, you have your medial, intermediate, and lateral cuneiforms. Sorry, might have said that wrong. Then you have your metatarsals, and similar to your hands, you have 5 metatarsals, and number 1 is for your big toe, just how number 1 is for your thumb. And then phalanges. So each toe has 3 phalanges to it, similar to the hands, except for the big toe, which only has 2. All right, I think that's everything. Hope you enjoyed the video, and I look forward to your feedback. Thanks so much.